Welcome back to the Wellness with Delaney podcast. Today I am with Dr. Maria Sokolina. She is a dentist with an amazing background, expertise in sleep apnea, TMJ, sleep. We are going to get into it today. So if you have been struggling with soreness in your jaw, getting poor sleep, if you have been struggling with that mouth breathing and want to learn how to activate nasal breathing for all the different health benefits and more, you definitely want to tune into this one. Dr. Maria, thank you so much for joining today.
I'm so honored, Delani. Thank you very much for inviting me. And I want, even in the beginning, to thank our mutual friend, Dr. Kathy Kennedy, inventor of the beauty balloon. She was on your show, and I have a lot of respect, and I want to talk about her generosity to connect great minds.
Absolutely. Yeah, I am so glad for that reciprocity there in just building those connections in the community that grows. The more that I get to chat with people, the more I meet other amazing people and get to build this community also for my audience. Okay, so tell us a little bit about the accent. Where are you from? How did you get into this?
Yeah, I'm actually from Russia, and I know right now with the political situation, there are a lot of controversy with that country. But yes, I'm from St. Petersburg, Russia. I got my first medical dental education there, and that's actually brought a lot to today's topic, the knowledge that I got from that background. I moved a long time ago. I moved in 90s when it was a very turbulent time in Russia. But the main reason for my move, a lot of people ask, I actually want to practice my profession in the way I'm practicing it right now. I want to offer people much more, aesthetic solutions when it was not available that time in Russia. So I moved to United States and I graduated from NYU and I did a general practice residency in New York, but Israel. That was a great experience because I had chance to learn from great medical professionals and treat medically compromised populations. So that gave me general knowledge as well. So dentists, not only about the teeth, we see a lot of things. We see basically whole health in the mouth, in the dark area. I was always looking to make a meaningful steps in my profession, to make a difference in people's life. But because I'm an aesthetic person, I assume it's going to be with a beautiful smile. But life turned differently, and I still help people with a beautiful smile, but I would say with more meaningful connection to overall health.
I love that. And there's something so beautiful when you help somebody have that beautiful smile and become more confident. You get to watch them blossom and they get to feel better about everything in their life because when you show up with confidence, it really does make you feel so good. So I love that you get to do that, connect deeply and help people feel good about their smiles. So, okay, before we were recording, you brought up something really interesting to me about how dentistry can connect to overall health and how you can determine a lot based on your saliva. So, can you tell me a little bit about saliva testing and what it can tell you about your health?
Yeah, this is, I would say, that's kind of a new direction in dentistry. I know a lot of medical doctors, and I have my own channel called Sleep Apnea Breathing Snoring Help, where I connect and I interview medical doctors. And I would be very honored if your audience can, join me, and I would be, honored to help them with their challenges and learn about the challenges. But on that podcast, I interviewed a lot of medical doctors, and the reason being because I want medical and dentistry to be more connected. But it was successful, not successful, let's call it. Then something wonderful came to my view. It's called salivary test. There are several, directions of that test. Saliva, it's kind of a part of the blood or a derivative of the blood, and you can get a lot of ideas from saliva. And I know in medicine they use saliva for hormonal testing, specifically cortisol. There are different use of saliva, not only how we start using it right now, but right now for dentists, I can do saliva test and find out what type of bugs actually live in a patient's mouth. And before before I start doing that, yes, we can examine the patient, and patient would say my gum is bleeding. But because when gum is bleeding, it doesn't hurt. That means I'm okay. Strangely enough, if your eye would start bleeding, you would be, oh my God, I'm gonna be blind. If you all of a sudden get bleeding from any other organ, you would be very concerned. But when you see blood in the sink, it's okay. But it's not, because that's the indicator of troubles in the cardiovascular department in the future. Because in the same way as blood vessels open for the blood to come out, it's also open for the bugs to get in. And those bugs, together with the systemic immune reaction, they actually contribute to formation of plaque inside of the blood vessels. But it was another wonderful discovery recently, and I interviewed actually father of the Facebook. I mean Edward Zuckerberg, father of Zuckerberg, who founded the Facebook. He is a dentist, and he is very much involved in developing of monoclonal antibodies for Porphyromonas gingivalis. That's a very common bug in the mouth. So those specific bugs cannot cross, they cannot get into the brain, but the toxin can get into the brain, and it's always found in the patients who have Alzheimer's disease. That
Wow.
type of plaque inside the brain. So periodontal health heavily contribute to mental health.
Wow. So you're telling me if my gum's bleeding and I get this bug through my gum, it can contribute to Alzheimer's down the road.
Yep. And there are a lot of research. You can Google Porphyromonas gingivalis and Alzheimer, and here it is. Or you can listen to Edward Zuckerberg interview on my channel, and you learn everything about that. It's a very scary discovery, but in a way, it helped dentists to be connected to the medicine, and it helped patients when they see the saliva test results actually listen to the dentist.
Yeah. Wow.
It's a
What other diseases can can be indicated through the saliva testing?
I'm going to show you this little book, what I use with the, I know it's with the green screen difficult to see, but that's names of the different bugs, what I found, through the test in a patient mouth. And each bacteria, it have a certain character, so they contribute to different disease. They all responsible for periodontal health. I'm talking about the bleeding when you brush your teeth. Bleeding, I'm just going to explain it very short. I want your audience to know why gums are bleeding. So they're bleeding because those bugs, we call it plug, make an ulcers inside the gums, next to the teeth, inside of the gingival pocket. And those ulcers, if you touch them, they start bleeding. They're microscopic ulcers. They're not huge ulcers, but it's the same, it's the same kind of mechanism as the ulcers inside the gut. So through those ulcers, blood coming out, bugs coming in. And now we're talking about those bugs. As I mentioned about Porphyromonas gingivalis, it's one of the main component of the plaque, and we can measure the amount of Porphyromonas gingivalis inside the plaque. It's a bad bug. And in this particular test, what I use called Simply Perio, we divide them into different groups: purple, red, orange, and green. Some of the bugs, they're responsible for cavities, for decay. So if a lot of Streptococcus mutans in the saliva, patient prone to develop decay as a child, adult, or as an older person, or not so old, for root decay, which is a really dangerous disease that can completely break the tooth. So, and other bacteria in between, there are a lot of them. Some of them actually telling me what patient is a mouth breather. and might have a sleep apnea. There are two bugs like that. And another bug, which found a lot inside colon polyps or colon cancer, telling me what patients should have a colonoscopy. So
Mm.
we can be on a preventative barrier for a lot of life-changing disease.
Wow, I did not know that. I don't think most people realize that you can help prevent long-term disease like colon cancer or Alzheimer's by looking at your saliva and at like the bacteria situation happening there. That could change a lot of people's lives.
I really hope so. Unfortunately, and as I mentioned before, I like that song by Steve Martin. I like him, and I like the song "I'll Be a Dentist." But how we have a stigma. We have a very stigma which is so deeply implanted inside people's brains. Oh, dentists are terrible people, money-hungry people, which only concern about the tooth. Um, that's how reported in the media with my channel and work I do when I write for Forbes, or when I talk to people on my channel or on a different podcast. I try to change that perception. What dentists are actually very knowledgeable and sophisticated professionals, and they have a lot of ways to help. But of course, if you're so scared and you avoid, it's not possible. Yes, if you're on a regular basis and you have a trust relationship with your dentist, that help. That significantly help. I know that's a difficult match. You have to find your professional, just like in any field, in our field as well. You have to feel comfortable. You should feel what the person, your dentist, understand you and listen to your concerns. And it might not happen like that. It might be, several tries, but just like everything in life. But once you find that professional and you be able to talk, that person can really dramatically change your life.
Mm-hmm. Absolutely. So I love this conversation because I think it is important for people to find that right dentist so that they can have these conversations and have that trust and hopefully prevent long-term disease. One question I would love to ask you, I know you kind of brought up how you can see different bugs that might indicate sleep apnea, and I know that you are an expert on sleep apnea. So what are the reasons that people develop this condition?
This is $1 billion question. And I'm
Mm.
writing a book about that. So I hope, I can bring the gift of my book to your audience in a very, I would say, storytelling way about sleep apnea. But I'm trying to find out why we have so many sleep apnea cases. And to be exactly precise, 24% male and 17% female in United States have sleep apnea.
Wow.
In Germany, Japan, and Poland, they consider it 50%. I don't know, maybe they have a better diagnostic. But in United States, there is a known fact that 87% of the people who have sleep apnea, they're undiagnosed. And they driving, they on the roads, they falling asleep behind the wheel. Luckily, for people who drive professionally, they have to have that sleep test to have a license, renewal of the license, continuation of the license. But everybody's driving in United States, so it can be very scary if somebody who wake up 70 times every hour. That's what I see on the sleep studies. They have those events, and then they don't have REM, they don't have deep sleep. We have a certain criteria when we're reading sleep test. It's scary what that person in the morning,
Mm-hmm.
drinking coffee, staying awake, getting behind the wheel.
Mm-hmm.
Or even more scary in the afternoon, because that's really gets dangerous. So, but talking back to sleep apnea, a lot of people suspect they have sleep apnea. They've been told, and maybe not in a nice way, because snoring is a ground for jokes, but it's not a laughing matter. A lot of people have a separate bedrooms. 35% of the houses built in the United States, they have two master bedrooms. So for obvious reason, for snoring. Very often I see people on the screen and couples and they said, no, you snore, no, you snore, no, you snore louder, but that doesn't matter. Okay, so people, maybe they know they snore, maybe they know they're gasping for air, they've been told, but they don't want to wear the CPAP. And they think that there's only one solution for sleep apnea, which is not true. Which is so not true, and that's what I write for Forbes, where there are multiple solutions for sleep apnea. And yes, I want to hope disease is preventable, but we're going to talk about that later. So reason for sleep apnea. Whenever I go to any gathering and I'll tell them what I do for living, I help people sleep and breathe in the same time, they would say to me, oh, my husband snore, my wife snore, my husband uses CPAP machine, my husband keeps CPAP machine in the closet, conversation like that. So topic is very acute. And I did several expeditions, I would call it this way. I went to Galapagos. I want to know what how genetic or epigenetic, what that factor played a role in developing sleep apnea in a modern time. And another expedition I did recently, I went to Ethiopia and I put a lot of reels on my Instagram about Ethiopia. Amazing fact. What people in Ethiopia, when I asked them about snoring, I asked tour guides, people who I travel with, they said, I know someone, like a celebrity, one person, distant relative, I know he snore. Like they would talk about someone, not like my husband, wife, somebody immediate. No, but they said every time we get American or European group, tourists snore so much. Because, in Ethiopia, living conditions, how, I sleep outside, in a camp, so you would know who snore, who is not. It's very obvious. So I was surprised with that fact. But another fact, I asked them about wisdom teeth. Oh, they don't extract wisdom teeth. That's not the case. All the teeth have a space in the mouth. But, I stay long enough. I have to eat Ethiopian food. I want to introduce myself to Ethiopian food. Yes, I eat only limited amount of things in Ethiopia. It's true. It's not a variety like we have in the United States. They do have processed food in the cities, but in the villages, not. But I try to eat meat in Ethiopia, beef, cut it in very small pieces. I was not able to chew it. It was so hard for me to chew, and I swallow almost unchew meat. But like it really, my jaw, I really like soft food, what I'm so used to eat here. So I was not strong enough to chew the meat.
Wow. So then their jaws are really strong and they're developing them from a young age. And that's going to make a huge impact in the snoring. I mean, what I've learned even about face fitness is like that strong jaw and the ability to chew like that can massively change snoring and mouth breathing and all that. That's crazy.
Absolutely. Like you absolutely right. And, you learn so much from, people who come and, from life on wellness, but it's true what a strong jaw contribute. We live in such an age, we cannot change and all of a sudden, start chewing that type of meat. We don't have it in the United States. Yes, we can focus on a fitness because fitness should not stop on a clavicle level and go below. It should be above, just like Dr. Kennedy talked about it on the podcast. It should be some fitness. It might be done with the chewing. It might be done with beauty balloon. It might be done with myofunctional therapy. That's the type of program we're offering to our patients who want to make a step and, stop snoring or make a treatment easier, make muscles of the lips stronger, make muscles of the tongue stronger and swallow just with the tongue without involvement of the other muscles and breathe through the nose.
Yeah. So as a dentist, as an expert here, are you a big recommender in like the beauty balloon space workouts for someone with like sleep apnea and snoring?
The beauty balloons, of course, we talk to patients about the beauty balloons as well, but it's part of the program. Myofunctional therapy, when we teach, there are a lot of different ways how we can train people with this instrument. This is the instrument, how you train it, and you can use it for your own home training. Like a beauty balloon is more like a self-guided set of exercise. We have a program with a trainer, with a coach, and depends on what specific pathology or a lack of certain muscle development patient have. We offer exercises for the first part of the course, and for the second part of the course we teach people how to drink right and eat right. So it's mostly with the food. Second part of the program is mostly with the food. For the first part of the program, it can be beauty balloon, it can be different tools what help patients to develop muscle strength of the tongue, especially lateral stability, sides of the tongue. A lot of people cannot do this.
Yeah.
Hold the tongue on the roof of the mouth, the back of the tongue can touch the palate. And this is really foundation for good night's sleep, because if tongue can stay suction to the roof of the mouth, it would not fall in the airway. But 70% of obstruction happen with the tongue.
Wow. Yeah. You know what's so crazy too is I actually wasn't super aware of the importance. I knew it was important to nasal breathe for a while, but I wasn't really aware of the importance of like tongue posture and mouth strength until a few months ago. And I started prioritizing, I started doing like my beauty balloon space exercises. I started doing all this, like really trying to prioritize all this. And I noticed because I was mouth taping before, I've been mouth taping for a long time, but I would feel my tongue like fall from the roof of my mouth regardless. I was still nasal breathing, but my tongue wasn't suctioned. But now I'm noticing my tongue is staying suctioned, and I can see it actually in podcast recordings when I watch back. Old episodes, my lips weren't sealed. And now in the past episodes, since I started working out my face, my lips are always sealed when I'm not talking. And I'm like, okay, this is working. This is crazy.
This is wonderful. Yes, mouth taping, and I'm a big proponent of the mouth tape. I'm friends with Patrick McKeown, who developed this one, myotape. But I also, recommend other tapes if people feel comfortable taping the lips fully. But it's a bandage. It's a bandage, and it's a bandage. It's not what help you to develop the strength of your lips. You have to work on the strength of your lip. And you're right about keeping your mouth sealed. When you're not talking and when you're eating, lips have to be closed. And now talking about the tongue, it's like a protective mechanism. To breathe through your mouth, you have to keep your tongue low. This way, your airway gonna be open. But if you breathe through your nose, it's fine. If your tongue stay on the roof of the mouth, you can still breathe with the nose. You also can breathe with the nose when your tongue stay low, if it's so used to that position. But I'm going to talk a little bit sophisticated medical terms, but I hope it's going to help your audience. So when people mouth breathe, they breathe with the chest. We call it chest breathing. We can say shallow breathing, but this is actually center of sympathetic nervous system. And if you notice when we run and we want to get that air so much, we want to catch our breath. We're using our mouth, but that's what I study with evolution. Actually, us and some type of a frog only breathing with the mouth.
Wow.
Dogs use the mouth instead of sweating, for perspiration, to make the body, to cool the body. Crocodiles keep the mouth open also for the same reason. So we breathe through the mouth, and we breathe with the chest, and wondering why do we have those racing thoughts when we want to fall asleep.
Mm.
Because
Because
we
you're
put
activating.
we're activating, we put ourselves in that fight or flight response. A lot of things what people consider they sleeping and then they wake up tired. For me, when I meet with people, with my patients, on a consultation, and I look at the sleep study, and I said to them, you're not sleeping, you're running a marathon. Look at your heart rate. It's triple. We consider ourselves good when we double heart rate in the gym, but you triple during your sleep. Look at that time when you're supposed to relax.
Wow. That's crazy. So then with the nose, is it activating parasympathetic because it goes
Pathetic
down to the
nervous.
belly?
It should. It
Okay.
should. Let's say it should. Another, known fact, what we take our breathing for granted. We were born to breathe, but were we born to breathe through the mouth, or we born to breathe properly using our diaphragm?
Mm.
And if we breathe shallow, we're not using diaphragm, we're not activating parasympathetic nervous system. And let's talk about nervus vagus, which actually consider that nerve what goes inside the guts and help us rest and digest. It starts on the roof of the mouth, underneath, or above the roof of the mouth. There are a lot of nerves, including that nerve. What we kind of give a message with the tongue when we put the tongue up.
Mm.
Clenching of the teeth. That's a sympathetic response. I don't know
Wow.
if you notice when not you, but I hope not you. I hope when people stress, they clench.
Mm-hmm.
And wonderful observation when happened, when there was COVID-19 pandemic, this unprecedented event what I would never be able to imagine in my wildest dreams. My office was closed, but every hour I would get a phone call about tooth fracture. It's not happening in a real life, but it would be tooth fracture or pain in the jaw joint. I have to manage it however I manage it from home. But I was surprised. I see the number, I get to the patient, fracture.
Wow.
I get the patient, oh, I have such terrible pain in my jaw joint, I cannot open my mouth. What can I do? And after that, I talked to a lot of dentists, and everybody talking about exactly the same situation.
Wow.
Fractures, it can be horizontal, vertical, whatever it is.
That's
And I
incredible.
notice now a lot of problem with the jaw joint. Like people come to me when they have pain in the jaw joint, TMJ treatment. A lot of people, whatever political inclination they have, they feel nervous. So what they do, they use the teeth to gain the balance.
Mm. So
And
they're really stressed.
it's sympathetic response. And if people would get trained either with beauty balloons or myofunctional therapy and keep the tongue on the roof of the mouth, that would actually make them feel a little bit more relaxed. I'm not talking about taking all troubles away, but I'm talking about the state of mind, state of
Yeah.
internal peace.
Yeah, absolutely. Then is there also a benefit to trying to eat harder to chew foods, like opting for that like tough steak versus like a ground beef situation when it comes to all of this?
That would be wonderful. Of course, exercise. If you can chew, steak, then you chew steak. I like to talk about that towards uh, future generations, towards
Mm,
kids.
yeah.
What, very common, what importance of the breastfeeding, that's number one, because that's a severe or strong exercise to get the
Yeah.
breast from the milk. And I know mother life, but I have two kids and I breastfeed them for a long time, for a year and a half. And yes, I was working, so it's a manageable situation. When I heard about it's not possible, if people ask me how to manage it, I can give my 2 cents how to
Mhm.
manage that. So I was very strict about breastfeeding my kids, and I was lucky enough. I had milk and I breastfeed. That was my goal, and I was lucky I was able to accomplish. But it can be different. It can be different. It can be different health situations, and it can be tongue tie situation also. So, for example, it's not possible. After that, after the breastfeeding, in our society, we give food from the can. So they
Mhm.
cannot chew either.
Yeah.
I'm not talking about that's wonderful how they do it in Ethiopia, but parents chew food for kids and then they give them that food to chew.
Wow.
And they practicing, the chewing.
Yeah.
And they have a totally different microbiome and they don't have such an enormous amount of allergies.
Mm.
Because there is a
Interesting.
theory, maybe that's not true, but according to articles, what I'm very much aware, what right now we live in such a clean society, what body
Mhm.
have that response to attack themselves. So
Mhm.
allergy might be representation of that as well as asthma. Uh,
Absolutely.
uh,
That's so crazy.
and in Ethiopia, in a society where they don't practice such cleanliness, very different. So talking about chewing the food, uh, I interview a lot of specialists in that area and a lot of pediatric dentists, and they recommend to give kids food what they can chew when they able to chew in small pieces, what they're not able to choke on it, but
Mhm.
they can chew it and use not a pacifier but a different device for the sucking. Sucking is good, but also what stimulate the chewing process.
Mhm. That, what's so interesting about this is probably a week or two ago, I randomly had this thought and I told my husband, because we haven't had kids yet, but we're talking about how we want to do things in the future. And I was like, is baby food really necessary? I feel like it's kind of a myth. And he was like, huh. And I was like, why do we have pre-processed foods in a jar with who knows what ingredients? And I was like, 100 years ago, was that the case? I mean, and so I started going down this rabbit hole of like, is baby food necessary? So you're saying that it could be really good to breastfeed until they're ready to try like sucking on foods and chewing on foods and developing that oral strength?
That's my firm belief. Like, they don't have a baby food in Ethiopia.
Yeah.
They leave, they leave
Yeah.
without baby food. They start on adult food. After I finish general practice residency here in United States, I was working for pediatric population in Patterson, New Jersey. So I saw only kids. I was surprised with the things for my, I was kind of newcomers, I was like in the United States for 4 years. Yeah, they start in Patterson, New Jersey, with a pizza in a 6 months old babies. I thought that's not exactly what I want to feed my kids.
Hmm.
But baby leaf,
Yeah.
it's not an example, but you can give apples, you can give things, carrots, in this, maybe they're going to be, in a safe way what baby cannot choke on that. That's
Mhm.
another scary thing. So you have to be very careful with what you choose for the baby to chew. But as I thought, and processed food is a processed food.
Hmm. Absolutely. All those ingredients you can't control for a young
No.
developing baby. I mean, I think all of this kind of points to like going back to what our ancestors did because we didn't have a lot of these things until very recently with like industrial revolutions and all these different big food corporations finding ways to make money. So, like, how can we go back to what was actually nature's design for babies and for adults? Because how we fuel our babies, I'm learning, at least as somebody who wants to have kids someday, like how I feel my babies can set them up for success or failure as adults. And that's a huge responsibility. It's scary.
No, there are a lot of things, like I mentioned, what dentists can see. Uh, of course, I was not practicing dentist after Industrial Revolution, but I read a lot of books about that. And there is a book what like a Bible to me by Weston Price, the dentist who in 1920s he traveled around the world to find out how come in prehistorical societies, societies what I met sort of in Ethiopia, in the communities when people don't use sugar, how come they have a normally developed jaw and they don't have a decay? And how come in the modern society who love toast with a jam in the morning, they actually have a lot of decay and they breathe with the mouth and they have a very small jaw with the crowding. So, 100 years ago, it was already known fact. Talking about mouth breathing, 200 years ago, the lawyer, I want to say his last name was Seldin, he wrote the book Close Your Mouth and Save Your Life, something, Shut Your Mouth, Save Your Life. It's a lawyer who reinvent himself and become an artist, and he traveled through Indian tribes and he learned a lot of wisdom, the wisdom what we actually lost unfortunately, what can bring a lot of health to our society. So one of the things what I love about that book, he noticed that after mom breastfeed the baby, she would put her fingers on the baby lip and close the mouth to stimulate baby to breathe with the nose.
Wow.
But who does it now? Who pay attention to that? So when you have your baby, do that.
Yes. Oh,
And
I
of,
will.
and of course, in the Indian societies, they did not have a baby food. So maybe parent chew the food, or they eat the same food as an adult.
Wow. That's really good to know for all the future parents out here or people who maybe want to have more kids and want to try things differently. Okay, so tell me about TMJ. What are there like certain causes of it? Are there ways that we can prevent it?
Yeah, this is a wonderful question. Thank you. And now, a lot of people suffer with that. So, temporomandibular joint disorder, very, very common. And usually it's a response to the clenching of the teeth. And sometimes people do it, they say, I do it at night. Okay. Okay. Usually people do it at night if they cannot breathe properly. So body have that protective mechanism. People they breathe with the mouth, clench the teeth together, move the jaw forward to open the airway.
Oh,
So they
wow.
do this. And it's open. And they
Right.
do it very often on the teeth. So sometimes in the morning they can eat something very soft and tooth can break. It's usually
Wow.
not breaking with the soft food or in the morning. It's usually, head effect at night. And during the day, if situation is not so balanced, they clench again. Our mouth so connected actually through the tongue. It's a fascia connection from the tongue to the big toe. So we have, mouth or head is not a separate organ. It's part of the body. So with that message, we activate a lot of other systems. And on my channel, I talk a lot about collaborative approach, the TMJ or clenching with physical therapists, behavioral ophthalmologists. So our vision and our teeth, very related. When we cannot find the balance and orient ourselves in a space, we use our teeth to create that.
Interesting. That's so fascinating because I actually know people who have both TMJ and vertigo. Would that be connected?
Yeah, it would be very much connected because they're trying to.
Right.
Yeah, and sometimes this is a very common thing what that collaborative approach can address.
Wow.
I had an interview on my channel with several specialists in this area. PRI Institute, they're very big on that. So in my office, we reprogram that with the guard. People wear special guard, but with the help of physical therapists, they can orient themselves in space and wearing special lenses to get rid of all these symptoms because we're not symmetrical. We have heart on the left, we have a liver on the right,
Right.
and very often we have some, posture or spine imbalance, pain here, pain there, fascia getting tight, and we call it torsion. So we're
Mhm.
trying to balance ourselves with the teeth. So
Mm.
TMJ is just a symptom of something different, what's going on. But to prevent these particular symptoms, my advice, keep lips together, breathe with the nose, but teeth apart. What
Mhm.
I see is so fascinating in the mouth, and I don't remember seeing it when I start practicing. I see huge, I'm talking about tables, huge amount of bone underneath the tongue in the front of the mouth. We call it bicuspids,
Mhm.
behind the front teeth on both sides. We call it tori. It's a bone growth from pressure, and they're huge. They can be on a palate also, as one piece, but on the
Mhm.
both sides as well. So that's fascinating what I see now in the mouth of my sleep apnea patients, or as well as people who don't have sleep apnea, but they do have temporomandibular joint disorders.
Wow. So for somebody who does suffer with TMJ, are mouth taping and face workouts a safe thing to
It's a
do?
wonderful, I would say, self-treatment, never a successful path. They need to have a captain of the team.
Mhm.
Uh, yes, nose breathing, huge plus. Sometimes people cannot breathe with the nose, so they need to be involved. They need to visit ear, nose, and throat specialists. They can suffer from allergies. It can be a long story. Usually, all of it connected.
Mhm.
But yes, myofunctional therapy, that set of exercise, whatever way you choose to have it, it's a great step because it's gonna help change the habit instead of clenching the teeth, pushing the tongue on the roof of the
Mm.
mouth.
So these things at home would be more like kind of like going to a gym for your own workout versus seeing a physical therapist. Like great to do together, but definitely doesn't replace that professional care.
And professional, because we use our teeth, we use our jaw in the lifetime, but professional have to show you the right way.
Correct.
Once you set in a routine, how sometimes people start with a coach, but then they have an idea and they meet the coach every 3 months just to make sure they are in shape, or like that, you know not to fall out of the wagon. So to set up the system, and then and sometimes it might be, facial, myofunctional therapy. Very often, it can be orthotic. I'm talking
Mm.
about the guard. Sometimes
Yeah.
it can be for a night only, and sometimes it can be for day and night. It depends,
Interesting.
because if you leave it unattended, there are some small changes in the joint, we can call it arthritic changes. So I see it on the x-ray, the joint becomes smaller in some parts here. And sometimes it can be completely gone.
Wow.
Then it's scary because your bite will change
Right.
significantly.
Absolutely. That's really good to know. I know a lot of people have been suffering with that. And I see it more and more lately. And I often see it paired with the vertigo. So it's really interesting to learn how connected it is.
Oh,
I think,
very.
yeah, I think a huge problem today is people are always treating the symptom and they're never looking at, which, yes, we want to treat the symptoms, but they're not seeing the symptom as a communication of a root cause and how connected the body is from head to toe. And like Dr. Katie says, we think about the clavicle down, but we have to think about the clavicle up as part of the whole greater system. It's not a separate entity. So when we can connect those things, it's beautiful. Okay, so one thing I saw that you chatted on your Instagram, and I was so curious, was about posture and how that connects to like orthodontic treatment. How does posture play into this whole greater picture?
Or, that head is part of the body. Number one, yes, I notice. Let's, kind of divide patients. So, while I was on a search for my career path, I was very interested in ortho. I wanted to become an orthodontist at a certain point, but it didn't happen. I was not, they did not admit me to the orthodontic residency. So we have a orthodontic residency, what you can take on your own. So I did. And they were talking so much about how orthodontic treatment can set a stage for the whole life, especially with posture. It was a treatment strategy when people have a crowding and certain, relationship between the jaw to extract four bicuspids, for teeth, to find the space for other teeth. And it was a standard of care. And I have a lot of patients who now have sleep apnea or temporomandibular joint disorder. And very often they have a forward head posture.
Mm.
To give you exact explanation why body changed it, I can't. One of the theories, what body put the head forward to help people breathe. And a
Mm.
lot of time when they come to me to sit in a dental chair, they cannot. I have to use the pillow because the head
Wow.
is so much forward. It might happen not only with the people who had for bicuspid remove, it might happen with other people as well. So, right now we talk about, using a device and holding the head like that. It might play the role because usually it's not one thing. It's everything, it's
Yeah.
several factors. But what I see with the posture, and usually I learn so much on that topic when I'm working with the physical therapists, because they actually address the posture, they address the balance of the body. I'm talking about hips, I'm talking about shoulders, I'm talking about spine, to prevent surgical involvement. Some
Mhm.
people prefer not to have surgery, so they can find other ways uh, with the physical therapist and with using teeth as a foundation for the balance. So, with the posture, yes, it's very much connected. And it's a lot of, I do three-dimensional x-ray for a lot of sleep apnea, for all my sleep apnea patients, and I do see spaces between vertebrae are gone,
Wow.
and sometimes on the left side, sometimes on the right side. I work very closely with craniofacial dentists who treat like that. So we're talking about torsion, like I mentioned. And
Mhm.
what I was surprised, and I learned it recently, actually through the book of my friend Dr. Laura Tarado, about stylohyoid. There is a small piece right here called stylohyoid ligament. It goes from the ear, let's say, to clavicle, but it's crossing carotid artery, so it's going through very important organs. And if patient trying to resist the torsion or keep body balance, sometimes ligament on one side disappear and this process disappear, and on another side going longer, get calcified. So body trying to stay in balance, it's very challenging to stay on 2 feet. It's not that many animals can do it like we
Yeah.
do. It takes a lot of effort for the body to stand on 2 feet and keep oriented in a space.
Yeah.
So, as you mentioned, that's the posture and that's the teeth. So that's like on top of the posture, trying to orient. And another very interesting um, observation, treating patients together with PRI, how in this particular treatment philosophy, they use foot inserts and orthotic together, kind of balance feet and balance teeth to be able to align the posture. So posture and the teeth definitely connected. That's
Wow.
statement number one. But probably science is not a closed book. And probably right now we only know tip of the iceberg. So I talk a lot about this particular philosophy in my book. Hopefully that can make this treatment philosophy known to public, and
Yeah.
people would start thinking about spine as connected to the head,
Yeah.
and address situations with the spine a little bit more comprehensively, not just like you said, treating only symptoms. Okay, the disc come out, but why?
Hmm. So good to know. Yeah, and I think that's where like that comprehensive care comes in, whether it's a chiropractor, like things, people who will help you with your posture as you're working on all of these things. Okay, so really fast before we do close today, I know that you have a free offering, a little gift for the audience. Would you mind telling them what
Yeah.
it is?
Yeah, I was so pleased with this podcast and honored to talk to your audience, and I have two free gifts. Number one, I'm very big on myofunctional therapy and sleep. So I create a questionnaire when you can kind of find out your level of your myofunctional development, what we were talking about, beauty balloon or just myofunctional therapy. You can find out. And then I have a video what you can do the exercise to breathe through your nose and hopefully sleep better. So this is gift number one. And gift number two for people who suffer from temporomandibular joint pain. Yes, you need to have a professional. Just like for sleep, if you don't sleep well, you need to have a professional help. But to basically guide you a little bit, you can use my gift. So temporomandibular joint pain, your level, and then the gift of exercise, what you can do to address this area. You have pain or not? If you clench, that would help you not to clench. Because number one rule, you have to keep your lips together, teeth apart, and tongue on the roof of your mouth. And sometimes it's difficult to do. So I hope this gift helped you to accomplish that.
Absolutely. Well, thank you so much. And I will make sure to put the links for you guys listening to access both this self assessment and the exercises for free. This is just a wonderful gift from Dr. Maria. So, and if you do the exercises, you do the assessment, make sure to share them and tag her and help get the word out there, because this is such an awesome free offering that we all can benefit from. I know I will be doing it myself. Well, Dr. Maria, where can people find you and connect with you?
Thank you very much for asking. I would be very honored if your audience can share their struggles, and we can help with my community, sleep apnea, breathing, snoring help. They can find me on the Facebook, on the YouTube, and the LinkedIn. And you can find me on Instagram, Dr. Maria Sokolina. And if you want to ask me questions directly on my website, Dr. Maria Sokolina, you can send me the message and we definitely find you the solution. If you don't live in this area, don't worry about that. I have a very strong network of the professionals who can help you in your area. And I would be very honored to contribute to your better health.
Amazing. Well, thank you so much. You guys,
Thank
if you're,
you.
yeah, I love this conversation. I learned a lot. And I think that this conversation of talking about tongue posture, like the mouth metrics, how we can optimize ourselves at home so that we can sleep better and just live better lives. I mean, I've been hearing more and more about this lately. And I'm so excited to have an expert like you on this topic on the show, because this has been something that people have been wanting to know more about. I know I've been deep diving on this topic, and it's been so life-changing for me personally. So you guys, if you love this episode, make sure to give us a 5-star review. Make sure to share it to your story and tag Dr. Maria and myself. Let's get this word out there about nasal breathing, about oral health, about saliva testing, and just how to live our best lives, starting at the mouth and connecting it to the rest of the body. Thank you guys so much for listening today, and I hope you have a wonderful rest of your day. I'm excited to chat with you soon.